Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Nita Valens, you're so gorgeous today.
Oh,
How
you're
come?
adorable. So, yes, thank you. And listen, you sound great. So what are we going to do for our listeners today?
We're going to talk about painful hips, painful knees, painful necks, painful backs, failed surgeries. What's a failed surgery, Nita?
Well, that's an elective surgery that someone chose to have, and it doesn't come out the way it was expected.
Kinda, yeah. It could be elective or it could be mandatory, but it could be failed. Failed just means that what Nita said. It doesn't come out the way you expected, the way you hoped, the way the doctor said it would be. And unfortunately, when that happens, it can be devastating. We've had people die. We had a woman on the show call up on the show about her husband coming out of surgery on a ventilator. You know what that means? A breathing tube.
Right.
And she didn't know why. She called up to find out why. What did her surgeon tell her?
I remember this. He said, I did everything right, and then he walked away.
Yeah. So careful. Most of these surgeries don't need to be done. It's almost like a vanity in America to be perfect. In other countries, they don't do all these surgeries, and people seem to get along fine. We have a treatment now that helps heal things that people get surgery for. So meniscal tears, rotator cuff tears, labral tears, anywhere around the body, in my humble opinion, do not need to be done and should not be done. And the studies show that it shouldn't be done. My book, which is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, I'm going to send you for free if you call the show right now. Write down, get a pencil and paper, write down the phone number to the studio, please. The number here is 866-870-5752. I'm going to read it again to you. Write it down. 866-870-5752. Anyone you know that has musculoskeletal pain, who's had a surgery that didn't work out, anything you want to know about with stem cells or platelets, which is called PRP, and injections instead of having a surgery, please call us now at 866-870-5752. This is a free book I will send out to you, and I will pay the postage too. In addition, if you want to call my office, you will get a free consult with my staff. And the phone number to my office is 1-800-300-9300. That's 1-800-300-9300. And if you want to watch me doing videos of these procedures, go to my website, www.jointrehab.com. www.jointrehab.com. There is a spot on every page to email me, so I answer emails all day and all night long when I'm not with patients or I'm not on the golf course. Sometimes when I take a break on the golf course, I'll even answer questions. I love communicating with people. So, Nita, I'm going to go right to a question. We actually have a caller here.
We do.
I'm going to go to John. It says he's a former patient, elbow and left shoulder. I hope he's got good news. John, hi, Dr. Marc Darrow.
Hello, Dr. Darrow. This is John from El Segundo, the real estate guy. How are you?
Oh, yeah. I know you, John. You're a good man.
Thank you. Well, likewise. And I'm not a former patient of yours. I'm a current patient of yours, but I just wanted to let you know how happy I am with the treatment that I'm getting from you. Last week, I was in for a second treatment on my shoulder. I've got like 5 tears or 6 tears on my shoulder, which you discovered after we had an MRI on it. And I'd say my shoulder's 40 to 50% better right now than it was the day of the injections. But the thing that I'm really pleased about is my elbow, which was hurting pretty good. And you did PRP injections in my elbow. Thank you very much. And in 24 hours, it was 90% better. It was a mind blower to me. And so I want to thank you for that. And I want to encourage anybody that's out there that's listening to this right now, don't hesitate, because this stuff works. And Dr. Darrow he's a kind man. He will do the best that he is conceivably can do to help you. And, and I'm grateful because my body parts are working a lot better. I'm on the way to being able to do a lot of the things that I haven't been able to do for a while. So
that's great, man. I'm really happy for you. And since you've been so nice to me, why don't you give out your cell number if you want to get some real estate business? I know you're a great broker.
Sure, that'd be awesome. Thank you. My number is 310-486-2197. That's 310-486-2197. And I've been in the real estate business for about 50 years. I have a pretty good idea of how to do it.
Well, you're a brilliant guy, John. I really appreciate you calling into the show and telling us about that. I do want to just ask you, what is it like getting these procedures so all the listeners can understand?
Well, I mean, you know, we go in, you have your blood drawn, and it doesn't take too long before it gets spun up and produces what you're looking for to inject. And there's no painkillers that's involved in it. You know, I drive in, I drive out, and it's a little bit uncomfortable. I'll admit that, but it's not an intolerable pain. It's not something that's going to make you, throb around on and kick and whine and scream. But I'll tell you, the results are so remarkable. I was absolutely dumbfounded on how well it worked on my elbow. Just blown away. And it's that, I don't know what that bone is called. It's on the inside. If I've got my arm extended and my palm is up, and it's on that bone that kind of is on the inside.
That's called the medial. Medial means middle. The medial epicondyle. And it's called golfer's elbow. But if it's on the other side, that's called tennis elbow, and that's on the lateral epicondyle. And,
I've got
also, just like your shoulder has tears in it, so does mine. And I've injected my own shoulder, and I actually am going to go play golf today. And
good for you. Awesome.
I have full range of motion, no pain. My shoulder was locked up at one point. I couldn't lift it above my waist. Mm-hmm. I was lucky because I could still do injections and go to work because I work from that level. But
well, I think you'll remember this. I had, among the things that happened on my right shoulder, I had probably 10 dislocations on that one playing sports.
Oh, I don't remember that. Yeah, okay.
And then I also tore my rotator cuff and the skiing fall, and they wanted to do surgery, right away.
Yeah.
And I wasn't interested in doing that, and I'm glad that I didn't. And I can see that, PRP or stem cells, with you guiding things and making sure that they go in the right spot, which is critical. That you can avoid a lot of that. You can avoid having somebody open up your skin and getting.
Didn't we have Dr. Thomas Grove do your injections?
We did. He rocks.
He rocks. He's a big athlete. He was, fullback at Nebraska?
He was a linebacker.
Linebacker, yeah.
Yeah, linebacker.
He's a great guy.
I told him, I said, you guys are going into Colorado this Saturday. It's going to be an ambush. He said, I know, and it was.
Yeah, he's a great injector. He's had amazing training with the best on the planet, and he's been doing this for a long time. And his skills are amazing.
You're the best on the planet, as far as
I don't know about best.
I've done my own research on that, but and your staff there's great. They're just also friendly. It just feels like home. It feels like I get greeted like I live there.
Well,
and
we do our best to love our patients as much as they will allow us to. And John, you're a very loving and spiritual guy, so it's easy.
Well, God bless you. I appreciate you, and just so thankful that you and I got connected and you're able to help me, and Dr. Grove helped me too. So God bless you, and I will see you soon.
All right. God bless, man. We'll see you soon.
Thank you, John.
So I'm going to give out the phone number to the studio. That's 866-870-5752. I want you to call me now, just like John did. We have Chris waiting. Be patient for a second, Chris. The number here, talk to me live, 866-870-5752. You'll get a free copy of my book, which I'm pointing to the camera right now, which is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And the foreword is by Suzanne Summers. I will send you this book for free, and I'll pay the postage. It's got 260 studies or so on how stem cells and platelets work and how surgery fails. And I know that we're in a society of surgery, but it's starting to change. People are wising up. The internet is teaching people that orthopedic surgery is necessary sometimes, but most of the time for these things like meniscal tears and labral tears and rotator cuff tears, it just shouldn't be done. The studies are coming out more and more now showing that the results are terrible with surgery. So be careful. Do not get a surgery if you don't need it. It's a mess. This is easy. You walk in the office, get injected, and walk out. You don't need anybody to drive you. We also do hair regrowth on the top of the head. If your hair is thinning, we can place the platelets or stem cells on your head, and we can also do your face. That's called the vampire facelift. I know it's a great name. We're coming up to Halloween, right? Vampire facelift is something I hope you never forget about. The name is cool. And we just take the same cells and we poke them into the face. We numb it up so you don't feel it. And it's a really great, great treatment. People, by the next morning, are looking better. So
how about Chris?
Yeah, we're going to get to Chris. Chris. You're from Costa Mesa. I love it down there. And you have neck pain, apparently. How long has your neck bothered you for, Chris?
It started in 2010.
Wow, that's a long time. It's like 13 years.
Yeah,
or
I
so.
have a condition called dystonia. It's a focal dystonia in my neck. I think it's called cervical dystonia, if that's the correct term.
I hear you. What's your questions about it?
Would stem cells help me with the pain in my neck? The muscles in my neck never relax.
Yeah.
And it's causing herniated discs.
Okay.
So I have 5 herniated discs in my neck.
Okay. Do you have any pain down your arm?
I've had that in the past. I've had 2 epidurals in the past, and that addressed it. Okay. But I haven't had the pain in the arms recently.
Good. So the herniated discs may not be the reason for the pain in your arms that you did have. It may be or may not be. I'd have to examine you to tell you. There are actually ligament referral patterns. Some people call them acupuncture points or trigger points. Janet Travell, who was John F. Kennedy's doctor, developed a system for that. Janet and Travell were doctors. And the trigger points and the acupuncture points are kind of similar, and they can refer from the neck down the arm or from the back down the leg. So don't get a surgery for that. You know, if you think
the doctor was actually very upset at me that I didn't want to do a surgery. I felt that if I did get my vertebrae fused, then the disc on the outside of the fusion would start to have the same problem that I already
That's right. That happens. The areas above, the discs above and below the fusion break down because of all the super pressure on them. So I don't like neck or back fusions, and I'm so glad your doctor was upset that you wouldn't get the surgery, because that's just a great talk about what we talk about on our show. Yeah, my doctors get upset with me all the time, and I've actually had doctors fire me. I'm a doctor, and my doctors fire me because I don't believe in what they do. The culture of medicine today is very medicine oriented and very surgical oriented, and that doesn't mean that's a good thing. In my estimation, it's a terrible thing. We want to look at things healing naturally, and many things can be healed naturally. Now, the focal dystonia, which means that your muscles are tight in your neck, is your neck bent over to the side?
Yeah, I have my head pulled to the right.
Okay. Sometimes we can help that, sometimes we can't, using platelets and stem cells. But the pain in the neck we can probably help you get rid of. So I have to examine you, and I tell this to every single patient. I get emails and calls from all over the world. Do you want me to send my MRIs and my X-rays to you so you can tell if you can help me? No. I need to examine you. I don't care what a doctor diagnoses, and I don't care what your images say. They're wrong. I'm sorry. They are wrong most of the time. And until a doctor touches the area and finds where the pain is generated from, they don't know what's going on. And unfortunately, I get so many people that come in with failed surgeries. That means they had a surgery that made them worse. And I say, did the surgeon touch you? No. Is that insanity? To me, it is. How can you tell what's going on from an MRI or any other image when that doesn't necessarily show you what's going on? We know that, and it's in my book, which I'm going to send to you for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. You'll get that for free, and I'll pay the postage. And there's studies in here that show that you can't trust images to tell you where pain is coming from.
Yeah. Well, thank you for that. So I would definitely be interested in getting a consultation. And
call the office. You'll get a free consult with my staff. They know a lot of this stuff too, obviously. And the number to the office, write this down, Chris, is 800-300-9300.
800-300-9300.
800-300-9300. And then also go to my website. There are videos of me injecting necks and backs and knees and shoulders and ankles and wrists and everything else. There's nowhere in the body I don't inject for musculoskeletal pain. And I use an ultrasound for the important areas that I need it for. And if you're getting injected in your, especially like the knees and the hips especially, and the shoulders, you need an ultrasound to see what's going on. We also use an ultrasound of the neck to see where that needle is going. And the website, write this down, Chris, is www.jointrehab.com. www.jointrehab.com. And for those of you listening who are shy, I hope you're not, and don't want to call up because you're shy, you don't need to be shy. We love everybody. But if you are shy, or if you catch the show at a different time, then you can go to the website, www.jointrehab.com, and every single page has a spot to email me, and I promise I will get back to you that very day. Okay? Any other questions, Chris? Anything else on your body bothering you?
No, that's really it. Thank you for your time, and good luck on the course today.
Yeah. Well, luck doesn't help me in golf.
Oh.
Lady Luck looks the other way when I play golf.
Oh.
Are you a golfer?
I try to.
Well, same with me. I try to, but I have a good time. I just enjoy being on a golf course, and although I love that occasional great shot, most of my shots they don't go where I want them to.
My neck is keeping me from doing physical activity, so my golf game is suffering because of this.
Okay.
It hurts to paddle when I surf.
Yeah.
So picking up my son is tough.
Yeah.
Well,
I think we can help you with your neck pain, and it may be just platelets alone, or maybe platelets and stem cells. I don't know. We would discuss that when you come in, and call the office. Get a free consult from my staff right now. It's 800-300-9300.
All right. Thank you, Doc.
God bless you, Chris. Good luck with your neck.
All right, bless you too. Thank you.
Thank you,
I
Chris.
love getting blessed.
Yeah.
Probably out of one every 30 blessings that I give, I get one back, and that's good enough.
Well, I'll bless you.
Do it.
I bless you.
Okay. I feel blessed, and
Good.
I bless you too.
Thank you. I feel blessed also.
All right. So I'm going to go to a joke because Nita loves being stumped. And we may keep asking Nita jokes until you call into the show at 866-870-5752. She feels like it's a little punishment, so help her out and call in. All right, Nita, you ready? You're on the hot seat.
Yeah, I don't feel like it's punishment anymore. I just wanted to tell you I have a new attitude about this. I really don't mind looking silly in front of people, and I like to laugh
it's not
and have
silly.
fun. So
My jokes are tough jokes. I think about them a long time.
I know.
All right.
You probably never sleep.
Not well. If athletes get athlete's foot, what do elves get?
New shoes.
Mistletoes.
Oh,
Isn't that cute?
That is very cute. That's very cute.
What do you call a sad cup of coffee?
A sad cup of coffee has no cream and sugar.
Depresso.
Oh, that's a good one.
One more?
Okay, let's do it.
How did the telephone propose to his girlfriend?
He went off the hook.
He gave her a ring.
Oh, of course. That's a good one.
Okay, I got one more because it's so cute.
Oh, no,
What?
I can't wait.
Come on, get ready.
Okay, I'm ready.
What did the cucumber say to the pickle?
Cucumbers don't talk.
You mean a great deal to me.
Ha! That's cute.
All right, I have one more because these are cute today. Why did the melons get married?
I have no idea.
Because they cantaloupe.
Oh, that is really a good one.
I know. And it's so cool because my patients send these to me. I have an idea, Nita.
Yes.
Why don't you send me some jokes and then I'll ask them and then you'll know the answers.
I'll think about that one. So
Okay.
Nobody called to rescue me at 866-870-5752. So
Yeah, let's give out the number once more. We want some callers. The phone number to talk to me live right now, Dr. Marc Darrow, 866-870-5752. Ask me any question about musculoskeletal pain, and I will have an answer for you. It may not be the best answer, but it'll be the best I can give you. And if I don't know the answer, I'll look it up and get back to you. All right, so let's see here. I have a question.
Okay.
Stem cell treatments for my back. Let's see what the person says. Oh, this is simple. Inquiring about stem cell treatments for my back. Okay. What's the most common back pain? Anybody know?
Lower back?
Well, it could be neck, back. It could be thoracic, the middle back. But the most common thing that I see, even though people come in with herniated discs, facet arthropathy, all kinds of crazy things, SI joint instability, arthritis, you name it, right?
Right.
But the most common thing that really is causing their pain, no one believes this. It's a sprain in the ligaments in their back.
Wow.
So does anybody go to a doctor when they have a sprained ankle?
I don't think so.
Not usually.
No.
Because why?
Because we kind of know what to do. You
kind of know it's not a big deal.
Right.
We know that they kind of heal up. Then why do they go to a doctor and get surgeries for back pain when it's the same syndrome? Oops, we're going to the break, and then I'll get back to this one, okay?
Okay.
So I'm going to give out the phone number to talk to me live after the break, 866-870-5752. The office number, if you want to get a free consult with my staff, 800-300-9300. And the website, jointrehab.com. Watch videos of me doing the procedures of platelets and stem cells.
All right, we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.